what role does spirituality play in modern medicine at the moment?
Yeah.
Very little for me. And I think it's very important. You explain that there with compassion. It is such a tricky area, I found, to communicate with people, because a lot of people who are that way inclined feel this as blame. I've made myself get sick. What are you saying, Dr. Maté? You're saying that my personality has caused my illness. And let's just sort of expand on that a little bit in case anyone is thinking like that.
Well, it's a really essential question. I would say yes, aspects of your personality contributed to the onset of your illness. Again, I don't use cause because there's so many different aspects to causation. But yes, aspects of it. But the reason it's important to pay attention to that is because if I could tell you that aspects of your personality, ways of being, contributed to illness, I'm also telling you that if you were to transform those, you could actually affect your illness in a very positive way. Now, that's the first thing. The second thing is, I would say, is it's not your fault. You didn't choose to suppress yourself. Those were adaptations to your environment. You didn't choose to put other people's needs ahead of your own, chronically and pathologically. That was your response to the environment. Why would I blame you for an unconscious adaptation that you developed when you were 2 years old and didn't know any better? So there's absolutely no blame in this perspective whatsoever, absolutely none. And it's inappropriate to even think of blame. But do people perceive it that way? Yeah, they can. But I would say to them, look, what would you rather have? What would you rather be told? That you're simply a physical object in the hands of your physicians with no agency whatsoever? Would you rather be an object in the hands of your physicians? Would you have some agency? Would you rather be actually involved and to learn how aspects of your life that you developed as a helpless young child are no longer serving you?
Yeah.
And if you alter them, I've done the same kind of research myself, is that whatever else people did, these healings were not spontaneous, didn't just happen.
No.
These people have changed their lives. They took supplements, they did yoga, they meditated, they went into nature, they got counseling, whatever they did. But the biggest change was in their relationship to themselves, And now I'm not saying we have a cure-all for everybody, but I'm saying that if these dramatic examples exist, what if we applied that all across the whole range of medicine? What if everybody with chronic illness, this question was raised, well, what is your relationship to yourself? And what extent are you being authentic? And you know what? This may sound surprising, and I don't recommend it. But even when I was working in palliative care, I had the occasional patient say to me, Doc, this cancer was the best thing that ever happened to me. They're saying this a week or two before they died. Why? Because I learned so much about myself that otherwise I never would have found out. It's made my whole life worthwhile. Again, people, I'm not recommending cancer as a way of waking up. All I'm saying is, even that experience, we can use it to learn something about ourselves from.
Yes, one of my core values is curiosity. I think every physician should have that as one of their core values, because what do we often do in medicine with these healings or these things we can't explain? We kind of pretend they're not happening. We can't explain them in our reductionist model, so they're not real. I don't know, maybe the patient's lying is often what people think, which is ridiculous. It's like, well, isn't that interesting that we don't know? Like, I love learning things that I don't know. Go, wow, what is going on there? And
but to interrupt for a moment, for curiosity, you have to let go of something.
Ego.
You have to let go of the ego that I know.
Yeah.
And unfortunately, physicians, it's not that they think they know everything, but they think that what they don't know is not worth knowing.
Exactly. Yeah. And also it goes into how you talk about culture, right? Unfortunately, a lot of people who end up in medicine simply went into medicine because they were good at school, at academic subjects. That is so common.
Yeah.
They often weren't drawn to healing.
Mm-hmm.
It was just like, oh, I'm good at school. I want to do a good job that pays decent money and gives me security. And I understand why people make those decisions. I really do.
Yeah.
But the truth is that at some point in your career, if you didn't go in for the right reasons, you don't actually figure some of that stuff out, you're going to be having quite an unhappy, discontented life, which is going to impact the way that you look after your patients.
Absolutely.
But this kind of emotional stress within our minds, the way we view ourselves, it is always, in my experience, a missing piece that unless we look at, we have a limit on our recovery. There's a patient I wrote about in Happy Mind, Happy Life, this 48-year-old lady who she had upper abdominal pain, she had bloating, she had bilateral upper arm pains, and she'd been to see a variety of physicians. She wasn't getting much better. The medications weren't helping. She then was reading things online. She was empowering herself. She made changes to her lifestyle. She changed her diet.
Yeah.
She would move more regularly. She would prioritize her sleep and stress reduction. And there was some improvement, but there was still a ceiling. There was still these symptoms afflicting everywhere. And when she came to me, I remember thinking, what are we missing here? What are we missing? Her life, a lot of these choices now in her life look pretty great. What's going on here? And as I compassionately inquired, right, it became very clear. She said something. This is what I knew. Oh, here we go. She said, Doc, I always end up in relationships with older men. They're usually married. Yeah. And they always treat me really badly.
That's right.
And as we sort of together inquired, we obviously all roots went back to her childhood, and she perceived as a child that her older sister got more attention than her from her parents. And it was incredible because even as she was saying it, you could see the light bulb moment in her own head. This wasn't physician healing the patient. This was, me just simply being a guide to help her find her own truth. And as she came to terms with that, as she did a variety of things to help process that, honestly, right, 6 months later, she ends up in a relationship with a man her own age who treated her really well. 3 months later, all the symptoms did her really well. 3 months later, all the symptoms had gone, and they haven't come back since.
Wow.
Right? This is real. Like, emotional stress is real.
Which is what you would expect if you understood the science.
Yeah, exactly. But it's not something we're taught. Yeah. And also something you said, Gabor, I think is really powerful, this idea of agency.
Yeah.
You say, what would you prefer? I mean, not to share with you what the science is? You just keep going in this disempowering model? No. Or explain. And that's something, I mentioned competitiveness before.
Yeah.
Competitiveness is, if you'd ask any of my friends, they'd say Ron is really competitive. He won't lose. They're right. I wouldn't lose. I would not. I would do anything I needed to do to not lose. But it wasn't because I enjoyed winning. It's because it was too painful. Yeah. Loss was too painful for me.
Yeah.
But now, hand on heart, I'm not competitive.
Yeah.
So it wasn't my personality. It was a behavioral adaptation.
Yeah.
And I no longer need that behavioral adaptation. And I think people don't get that. They think the personality, who they are now, is who they have to remain.
Well, let me just, I phrase that a little bit differently. I mean, the concept we totally agree on. I would say it was your personality, but your personality wasn't who you were.
Yeah.
In other words, the personality is an amalgam of genuine aspects of ourselves with these adaptations.
Yeah.
And what we can actually do is to purify the personality so that there's no distinction between ourselves and there's no contradiction between ourselves and our personality. So certain personality traits are not us at all. They're simply who we learn to be in order to get through.
And we can unlearn them.
We can absolutely unlearn them. And sometimes, of course, illness comes along. Just, again, if somebody got sick, I'd never go to them and say, listen, congratulations, this is a great wake-up call, learn from it. I would never say that to anybody. Because that's, people have to come to that realization themselves. But I would ask them, have you considered the possibility that, along with the physical treatments we're going to give you, have you considered the possibility that there may be aspects of your life that have contributed to the onset of this condition that'd be worth investigating so that you can become empowered to do something about them? Even in 10 minutes, you can say to a person, there's some considerable evidence that your rheumatoid arthritis, that your lupus, that your multiple sclerosis, like your inflamed bowel, is related to emotional factors, is that something you'd be willing to explore in addition to whatever treatment I'm going to give you? Are you willing to talk to somebody? I'm not expert to talk about that. I wasn't trained to do that, but I'm aware of those relationships. Are you willing to talk to somebody? So the physician doesn't have to do it all.
Yeah.
The physician just has to be aware of it. That's all. And let me just say one thing, something else that occurs to me that's really important to say here. It's not exactly apropos, but it does come up for me. This is not just individual; it is also social. If you look at here in Britain, who was more prone to develop COVID, it wasn't just. They say that we're all in the same boat, we're all in this together. No, we weren't. People that were black or immigrants of color, they were at much higher risk. Yeah. In the United States, people of color were at much higher risk of COVID. People of color in my country, Canada, an Indigenous woman has 6 times the rate of rheumatoid arthritis than that of other people. This is amongst the population and never used to have autoimmune disease whatsoever. And so we're not just talking about individual choices or even individual personality traits. We're also talking about large social trends that exclude or oppress or put extra burden on, on certain segments of the population. So we have to really, I just want to make sure that we broaden the conversation beyond the individual to the social level.
Are things that if we empower ourselves that we can do.
Yeah.
I also want to just say I totally agree on the 10 minutes. It doesn't have to be a barrier. Sure, more time would probably be optimal.
Yeah.
But even having a physician who's aware and then says, and points into one of your books, for example.
Yeah.
That's useful. I know there are thousands of medical doctors now who, certainly in the UK, because they talk to me and they contact me and they say, yeah, I've only got 10 minutes, but I just raised something and then I point them to one of your podcasts or one of your books.
Yes. Yeah.
And so it's a way that you can,
That's right.
Because this information, this can help patients in their own time when they're gardening at the weekend or going out for a walk. They can be learning. And that's one of the things that gives me hope at the moment is that this information is not behind locked doors in universities and research institutions. People are consuming this content. People, if you look at your talks on YouTube, millions of people have watched them and are then empowering themselves.